Ladies and gentlemen, the world has been vigilant in monitoring public health developments, particularly following the challenges posed by the COVID-19 pandemic. Today, attention has shifted to reports from China regarding a respiratory virus known as HMPV, or human metapneumovirus. While some social media posts claim hospitals are overwhelmed and a state of emergency exists, there is no evidence to substantiate these claims. Therefore, it is vital to separate fact from fiction and focus on verified information. What is HMPV? HMPV is not new. It was first discovered in 2001, though research shows it has likely been circulating for over 60 years and is found globally. This virus primarily causes respiratory illnesses similar to the common cold and, in more severe cases, pneumonia. However, it is particularly dangerous for three groups. 1. Young children whose immune systems are still developing. 2. The elderly who may have weaker immune responses. 3. Immunocompromised individuals who are more vulnerable to infections. In China, over the past 5 years, HMPV has been responsible for significant increases in respiratory illnesses, particularly in vulnerable populations. A December 2024 report from the Chinese Center for Disease Control and Prevention, China CDC, noted that HMPV accounted for 6.2% of positive respiratory illness tests during a surge in infections and 5.4% of respiratory-related hospitalizations during the same period. Symptoms of HMPV. The symptoms are similar to many other respiratory illnesses, such as cough fever, nasal congestion, shortness of breath. For most people, these symptoms will remain mild, but in vulnerable populations, they can lead to severe complications, such as bronchiolitis or pneumonia. Recent data from China indicates that children under 14 are among the most affected groups. How does it spread? HMPV spreads in much the same way as other respiratory viruses, such as the common cold or COVID-19. 1. Through respiratory droplets expelled when an infected person coughs, sneezes, or talks. 2. By touching contaminated surfaces and then touching your face, especially your eyes, nose, or mouth. How can we protect ourselves? While there are currently no antiviral drugs or vaccines specifically for HMPV, practical measures can help reduce the risk of infection. 1. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds. 2. Wear masks in crowded places, particularly during outbreaks. 3. Boost your immunity by maintaining a healthy lifestyle, including proper nutrition, regular exercise, and adequate sleep. 4. Stay home if you're feeling unwell to avoid spreading illness to others. The global context and the role of transparency. The World Health Organization, WHO, has urged China to share detailed data on the virus's spread to help researchers identify patterns and develop preventive strategies. Transparency and global cooperation are essential for addressing HMPV effectively and mitigating its impact. While HMPV poses a health risk, it is not a new or unknown virus. Its seasonal surges are well documented, and health authorities worldwide have experience managing its impact. For context, HMPV causes millions of infections annually and accounts for thousands of hospitalizations globally. However, severe cases are primarily limited to vulnerable populations. A call for caution and credible information. As we navigate this health concern, it is crucial to rely on credible sources like the WHO and public health organizations. At the same time, we must avoid panic and misinformation, which can spread rapidly through social media. Let's stay vigilant, informed, and proactive in our precautions. Together, we've overcome significant public health challenges in the past. With cooperation, transparency, and sensible precautions, we can address this issue responsibly and minimize its impact on our communities. Stay informed, stay safe, and take care of yourselves and your loved ones. Thank you.